Good morning. Today let's talk about asthma in pregnancy. Asthma is one of the commonest chronic medical condition of the respiratory system. So, if a woman is having asthma and becomes pregnant, we should be in position to handle this mother, preferably give the first aid, and then we may need to refer as quickly as possible if this mother has gotten an asthmatic attack. But before we do that, let us understand asthma as a condition, as a chronic medical condition. So by definition, asthma is a chronic inflammatory airway disorder, and it is characterized by airway hyperresponsiveness, airway edema, and mucus production. So the key things is hyperresponsiveness, that if there is any stimulant, any allergen, which the patient is reactive to, the airway will be quickly responsive, will respond quickly by causing an inflammatory process. And this inflammatory process will lead to airway obstruction by edema and then mucus production. Let us look at the pathophysiology. How does it come about, and how does it bring signs and symptoms? So asthma results from a complex variety of responses in relation to a trigger. A trigger is that something which will lead to the hyper reaction or hyper responsiveness. The process begins when the mast cells, the T lymphocytes, the macrophages, and the epithelial cells are involved in the release of inflammatory mediators. These are some of the immune cells in our body which help us to fight disease if there is anything which is affecting our body. So these T lymphocytes and epithelial cells situated in the airway, they release the situated in the airway. So they are in the body and they release the inflammatory mediators. And they are saying that the eosinophils and the neutrophils migrate to the airway, causing injury. So these chemical mediators, such as histamine and platelet activating factors, contribute to the inflammatory process. This will lead to prolonged airway constriction. So inflammatory process, we remember that the key signs of inflammation is swelling, that is edema, pain, and maybe loss of function. So we look at a trigger, any trigger this patient is allergic to will trigger the T lymphocytes, the macrophages, because they are in position to fight for the abnormal antigen which is coming in or which the body has sensed. So these are cells and white blood cells which work for our immune system to fight. So if this patient is exposed to any trigger, these T lymphocytes and macrophages will release what we call the inflammatory mediators. And these inflammatory mediators, those are the eosinophils and the neutrophils, will affect the airway And as they affect the airway, they cause the inflammatory process. And as a result of an inflammatory process, the airway will become odematous. That is the swelling. And after becoming odematous, it means it is going to block the airway, leading to airway constriction. The autonomic neurocontrol of airway tone is affected. Airway mucus secretion is increased. Mucociliary function changes, and airway smooth muscle responsiveness increases. So as a result of edema due to inflammation, the airway will become constricted, and it means the patient will have a problem with inspiration and expiration because the airway is obstructed. Basically, we talk about the trachea, the bronchi, and maybe the bronchioles. So these organs will become affected, and the patient will have compensatory methods to ensure breathing. And due to that, the patient will have an obstructed airway. As a result, we have said there is bronchoconstriction, airway edema, and mucus plugging will occur. So due to a result of inflammation, there will be edema. Then the mast cells will start producing the mucus, which mucus will continue to block the airway. So that is how the attack will come in. So when you look at this picture, let's assume this is a bronchi or a broncho or a trachea. For a normal one, we shall have a very good passage of airway. So when asthmatic attacks come, this airway will become constricted. And as it will become constricted, look at the edema, and then it will start producing some mucous membrane, which both the two are causing airway obstruction. So that is in brief. So what may be the causes? The causes, asthma is thought to be caused by a combination of genetic and environmental factors. When we say genetics, it means a gene can be inherited from the parent, and it can also be exaggerated by environmental factors. So by environmental factors, they include exposure to air pollution and allergens. Other potential triggers include medications such as aspirin and beta blockers. So if this person is not genetically predisposed to asthma, other environmental factors may be prolonged exposure to airway pollution. When you look at people working in factories that produce a lot of pollution, air pollution, for example, those working in milling factories, who mill the posho, these people who carry the posho, people in working with cement, people working maybe in tobacco factories, these people are exposed in a very long period of airway pollution. So this can be a cause of asthma if this person is not genetically predisposed. Whereas other people are genetically predisposed, that an asthmatic gene is being transferred from the parents to the offsprings. So now let us look at asthma. People who are asthmatic may not be having a problem, but the problem is the asthmatic attack. Now, what may bring about the asthmatic attack? Those are the asthma triggers. Those are exposure to various irritants and substances that trigger allergies. They can trigger signs and symptoms of asthma. What does it mean? When this person is exposed to an irritant, they will be that hyper-responsiveness. And that hyper-responsiveness is the one which is going to cause the signs and symptoms. And asthma triggers may be different from one person to any other person. And these may be some of the few which we can mention. Airborne substances such as pollen, dust, mites, pollen pores, pet dander, or particles of cockroach waste. These are things we normally live with, especially in Africa or communities of low socio-economic status. These can be triggers to an asthmatic attack. Then another one can be respiratory infections such as these common colds. It can be physical activities or exercise-induced asthma. When this child or mother or person have an exercise, runs or what, it can be a trigger to an asthmatic attack. Then cold air, as most of the culprits know that in cold weathers they usually get the asthmatic attack. When we say air pollutants and irritants such as smoke, that is well explained. Then some others are certain medications, including beta blockers, aspirins, and ibuprofen. Then strong emotions and stress can also be a trigger to an asthmatic attack. Then we have sulfites and preservatives added to some types of food and beverages. Some of the people are very sensitive to key ingredients in the food, and you hear them say that if there is curry powder, I don't take that food. If there is green pepper, I don't take that food, such that they know that these are triggers to their asthmatic attacks. Then there is what we call the gastroesophageal reflux disease, GERD. This is the condition in which the stomach acids back up into the throat. This is common when the cardiac sphincter is loose. So the HCl in the stomach, when it regurgitates back into the throat, this can also cause an asthmatic attack. So what may be the signs and symptoms? So signs and symptoms vary from person to person, from children to children, and people who have lived with asthma, they, with time, learn what brings about or what triggers their asthmatic attack. But this, to mention by a few, as we have said in the pathophysiology, that when there is a trigger, there is a hyperresponsiveness of the respiratory mast cells, which brings about inflammatory mediators and therefore cause edema of the airway. So this edema of the airway, of course, brings about the blockage of the airway system. Therefore, there is shortage of oxygen. And as a compensatory method, the body will try to breathe faster. That is a tachycardia or shortness of breath. So due to airway obstruction, the patient will complain of chest tightness and even pain. Because of the pain, the patient will have trouble in sleeping. And this is caused by shortness of breath, of course, coughing, and even wheezing. Wheezing is a harsh sound on expiration. If we can get a difference, wheezing is a harsh sound on expiration, whereas we call the stridor, which is also a harsh sound on inspiration. So wheezing is a common sign in asthmatic patient that the patient will have a problem with expiration. A whistling or wheezing sound when exhaling. So we have talked about that above. Coughing or wheezing attacks are worsened by respiratory viruses such as cough and flu. So if this patient is having cough and flu, we shall have a problem or it will worsen. So that is in brief the pathophysiology of asthma.